Hello everyone, and welcome to another training session with Corsmed. Today we're going to do the lumbar spine protocol. I'm going to take it step by step at a nice slow pace and make sure you get every image of high quality. I'm going to swap over to the MRI simulator and we'll get started. Here we have the Corsmed MRI simulator, which is where I will demonstrate how to run this protocol. So why is the lumbar spine such an important protocol to learn? The MRI lumbar spine study is essential because it provides a detailed view of the lower back. And this area is a common source of pain and other neurological symptoms. There are many clinical indications that may cause a healthcare provider to request a lumbar spine protocol, including low back pain, disc herniation, suspected spinal canal stenosis, spinal trauma, or fractures, and even specific cases such as congenital spinal malformations and tumors. In addition, MRI also offers excellent soft tissue contrast, which helps us identify conditions that X-rays or CT scans might miss. So let's now get started with our simulation. We will assume that the patient is already positioned in our scanner, following all the safety regulations. But before we start with the sequences, we should always first check the hardware settings of our MRI system. We have selected the optimal coil for our scan. This coil is positioned at the back of the patient, ensuring we get perfect coverage of the lumbar region and an excellent signal acquisition. We are also using a magnetic field strength of 1.5 teslas and a maximum gradient strength of 45 milliteslas per meter. This configuration is standard in many clinical MRI systems today. It's very important to consider the hardware setup when adjusting our sequence parameters in order to achieve the best diagnostic image quality. Now, we will place the initial localizing images of the lumbar spine in the viewports. These images must be positioned in 3 anatomical planes: axial, sagittal, and coronal. We will then locate the central slices. These will allow us to visualize the lumbar region's anatomical structures and prepare for our slice planning. Next, we will add the protocol sequences for this study. However, I want to emphasize that there's no single correct way to perform a lumbar spine protocol. The setup I'll show next is a good standard for the majority of cases. But your organization may have its own guidelines. So always check if your organization has any particular specifications, and if so, you should follow those. A standard lumbar spine protocol will typically include 5 different pulse sequences: 1 coronal T2 sequence, 3 sagittal sequences in T2, STIR, and T1 contrast, and 2 axial sequences in T2 and T1 contrast. Unlike other imaging modalities, MRI provides the unique ability to obtain multiple contrasts. This allows us to visualize both anatomical structures and eventual pathologies with exceptional clarity. Let's now proceed with our sequence selection and begin with setting up the coronal T2 sequence. For slice planning and angulation, we will use the spinal cord as our anatomical reference. This sequence must include all 5 intervertebral discs in the lumbar spine: L5, L4, L3, L2, and L1. To angle the coronal plane properly, we will align our slices parallel to the spinal cord on the sagittal localizer. We also need to align the slices so they are parallel to the transverse processes of the vertebra. You can see these 2 transverse processes over here. Next, we will configure the geometric parameters for our acquisition. We need a field of view that is wide enough to include the entire lumbar region. We will adjust the slice thickness and slice gap to ensure optimal spatial resolution. Then, we will select a sufficient number of slices to cover the lumbar spine, from anterior to posterior. Now, we will center our slice package. It is very important that we make sure to effectively cover all 5 lumbar discs. MRI systems allow us to visualize all added slices as a standard option. Many users prefer the box view option, which displays the region of interest while hiding intermediate slices between the first and last slice. Let's check that the echo time and repetition time are set correctly to give us a T2 contrast. We must also check key parameters like bandwidth and bandwidth per pixel. These should be set to avoid chemical shift artifacts, and they must be optimized according to the magnetic field strength. The fold-over suppression parameter is tied to the phase encoding direction. For this coronal T2 sequence, the phase direction runs from right to left. By activating fold-over suppression, we will see a dotted line extending along this phase direction. This oversampling prevents wraparound artifacts, which can be caused by anatomy outside the field of view along the phase encoding direction. It's important to remember this relationship between the phase encoding direction and fold-over suppression. Finally, let's review the turbo factor or echo train length configuration. This value is based on the chosen effective echo time and helps adjust the sequence acquisition time. It is a good practice to always verify acquisition indicators to ensure we get optimal image quality, acquisition time, spatial resolution, and signal-to-noise ratio. Once we have verified that the indicators look good, we will run this pulse. Next, we will plan our sagittal T2 sequence. The slice angulation for this sequence will also follow the direction of the spinal cord. We must ensure a symmetrical slice angle relative to the vertebral body, which you can see here on the axial localizer. In the coronal plane, we will navigate to the spinal cord and align our slices parallel to it. We will adjust the field of view here so that it also fully covers the lumbar region. It is recommended to include from the last 2 thoracic vertebrae above discal 1 down to the sacrum. You can see the sacrum in detail down here. Next, we will set a slice thickness and spacing similar to the coronal plane for optimal spatial resolution. We will also ensure enough slices to cover the lumbar spine from right to left. It is strongly recommended to use high-resolution sequences for planning our next sequences, as they provide excellent reconstruction quality. For example, our recently acquired coronal T2 sequence provides a detailed visualization of the lumbar spine. This allows us to confirm precise centering and angulation and make any necessary fine adjustments. Let's again check that the echo time and repetition time are selected for T2 contrast. The bandwidth and fold-over suppression must also be correctly configured. In the sagittal plane, it is also recommended to set the phase direction from superior to inferior or foot to head. This matches the flow of the cerebrospinal fluid, which also moves from superior to inferior. By aligning our phase direction with the cerebrospinal fluid, we reduce the risk of flow artifacts. Finally, let's confirm that the turbo factor or echo train length is effective for the chosen echo time, matching the coronal T2 settings. We will also ensure we get a proper balance between acquisition time, resolution, and signal. Once verified, we can click on Save and run this pulse. Now, let's begin working on the sagittal STIR sequence. A simple and practical approach is to copy the planning from the sagittal T2 to the sagittal STIR. This function is commonly available in MRI systems, and it ensures we get exactly the same slice positioning in both sequences. This lets us compare the images from the two sequences more closely. This third sequence, called short tau inversion recovery, or STIR, uses an inversion recovery pulse. The selected inversion time effectively suppresses fat signals due to their short relaxation time. In a 1.5 Tesla system, optimal fat suppression times typically range from 130 to 150 milliseconds. Longer inversion times make fat appear darker, while shorter times reduce the suppression effect. The final contrast must suit the preferences of the radiologist who will view the images. Once again, we verify that the image quality indicators and acquisition times are suitable. We will then click on Save and run this pulse sequence. Now, for our sagittal T1 sequence, we will copy the geometry from the sagittal T2 sequence. Let's confirm that the echo time and repetition time are correct for achieving T1 contrast. A common practice in lumbar spine acquisitions is the use of saturation bands. These bands suppress artifacts caused by factors like involuntary movement from the abdomen or intestines. Such movements can interfere with the lumbar region, especially in sagittal slices, which can reduce the quality of our images. To address this, it is recommended to position an angled saturation band over areas of motion, while avoiding contact with radiologically important structures in the lumbar spine. Specifically, we want to target the intervertebral discs. Let's again check that the acquisition time, spatial resolution, and signal-to-noise ratio are suitable. We will then save and run this pulse. Now, we will plan the axial plane for the lumbar spine. This plane is typically acquired using multi-angle and multi-stack techniques, referencing the intervertebral spaces. The angulation should be parallel to each intervertebral space within the lumbar spine. So we will adjust each stack in the sequence to match these spaces. Specifically, the 5 intervertebral spaces we need to align with are S1 L5, L5 L4, L4 L3, L3 L2, and L2 L1. So let's set up a total of 5 stacks with appropriate slice thickness and slice gap to get a good spatial resolution. We will navigate towards a central slice on our sagittal T1 that clearly shows intervertebral spaces. Let's begin with the first package. For the axial plane, we will select 3 slices. These slices will be angled parallel to the first intervertebral space and centered appropriately. And we will progress through each stack by adjusting the plane orientation, slice count, and angulation to match each intervertebral segment. It is recommended to center each stack from anterior to posterior between the spinal cord and the intervertebral space. Finally, let's do the last of the intervertebral spaces, L2, L1. In addition to centering anterior to posterior, proper left to right centering is also crucial. We can use the coronal plane for this purpose. In patients with scoliosis, significant angular deviations are common. It's therefore important that we verify our angulation of all intervertebral spaces. We will check each stack individually, centering and angulating it as needed. Let's now angulate the final intervertebral space down here in the coronal plane. Perfect. Once we have finalized the positioning for all stacks, we will check that the echo time and repetition time are set up to give us a T2 contrast. We will also verify the turbo factor or echo train length to ensure the image quality indicators meet the clinical institution's standards. We will then click on Save and run this T2 axial sequence. Finally, for the Axial T1 sequence, we will copy the prescription from the Axial T2 sequence. This ensures we maintain identical planning across all stacks. We will then verify that the echo time and repetition time are set up to give us a T1 contrast and that we have an appropriate turbo factor for this effective echo time. Our sequence will then be ready to run. Let's now examine an interesting phenomenon that we can see in axial acquisitions. Here, we can see a dark line that appears at the posterior aspect of the lumbar spine. This is caused by overlapping slices across the multiple stacks we planned earlier. This artifact is known as crosstalk. Notice how this overlap clearly shows in our sagittal plane. Fortunately, this artifact does not extend into our region of interest, so our image is still viable to be used by radiologists when making a diagnosis. This specialized axial slice planning improves the visualization of potential protrusions or nerve impingements in the lumbar spine. Let us zoom in at our vertebral body and ensure that the crosstalk is not present in this region. Excellent. Once reconstructions are complete, let's review the image quality obtained across all our sequences. The T2 weighted sequences will provide essential assessments of the ligaments, tendons, and inflammatory processes. You can see these structures here in the left and middle viewports, where our T2 sequences are displayed. The STIR sequences, in contrast, are excellent for evaluating potential fractures, particularly in bone marrow regions. Notice how the selected inversion time effectively suppresses the fat signal in the image. Finally, let's upload our T1 sagittal and axial sequences in the left and right viewports. As you can see here, the T1 sequences offer exceptional visualization of the general anatomy, including detailed exploration of soft tissue integrity. With that, we will wrap up this video tutorial. I hope you have now gained a greater confidence in how to perform a lumbar spine protocol. To recap, here are the most important takeaways to remember. First, we mainly use fast or turbospin echo sequences for this protocol. This type of sequences allow us to create image contrasts in T2 and T1 weighting, as well as inversion recovery for fat suppression. This helps us to assess the integrity of the lumbar spine and check for common pathologies. Second, when you run your sequences, you want to have a balance between scan time, resolution, and signal-to-noise ratio. However, you may want to slightly prioritize scan time, because the lumbar spine is such a commonly requested protocol in MRI practice. By optimizing slightly for scan time, you will be better able to complete all the incoming requests in time. Third, make sure to avoid the common artifacts that can arise from the lumbar spine region, which include motion, flow, chemical shift, wraparound, and crosstalk artifacts. Some techniques we can use to avoid these artifacts are to apply saturation bands, set up our phase direction alongside the flow direction, adjust the bandwidth, activate fold over suppression, and minimize slice overlap. If you cover all these 3 points, you will be able to perform excellent lumbar spine MRI protocols. Thanks for joining, and I will see you in our next session.